Oh, how is she doing that? Hello. Genital herpes is a problem that plagues many people in our society. Today, I'm going to tell you a bit about it. Now let's define our problem, shall we? Our goal is to reduce herpes infection rates by 20% in Australia by the year 2025. Herpes is a sexually transmitted disease or sexually transmitted infection caused by the HSV, herpes simplex virus. The virus affects the genitalia, the reproductive system in other words, and also other areas such as around or in the mouth. There are two types of herpes simplex viruses, HSV1, otherwise known as herpes type 1, or HSV2, otherwise known as herpes type 2.
Herpes is very prominent in the reproductive system and on many other parts of the skin, such as the mouth. Herpes symptoms may include cold sores around the mouth and genitals, cracked, raw, or red areas around your genitals without pain, itching, or tingling, itching or tingling around the genitals, small blisters that break open and cause painful sores, pain during urination, headaches, backaches, and flu-like symptoms, including fever, swollen lymph nodes, and fatigue.
Now let's discover some more about our problem. Who is most likely to get genital herpes? Well, people most likely to get genital herpes are people who have a lot of unprotected sex with people who have genital herpes. Anyone can get genital herpes if they're not careful, so stereotypes are completely unscientific.
HSV1, type 1, is spread through contact with saliva, including kissing and mouth-to-genital contact, such as oral sex. HSV2, type 2, is usually transmitted by actual sex. In the past, HSV2 was responsible for most cases of genital herpes. However, recent research suggests that almost 80% of students with genital herpes have type 1. If you have herpes, no one's going to want to have sex with you. No one will take the risk. Look at this unfortunate soul. He has a severe case of herpes. He also has an unsatisfied libido and is depressed. Look at him. Pathetic. Don't risk herpes.
It says here that herpes mainly affects the genitalia of men and women, which is very important for reproduction and, of course, being human. Is that right?
Yes, it is. It also says here that symptoms may include discomfort when urinating, vaginal discharge, blisters that itch, hurt, or may break open, swollen glands, head and muscle aches, elevated temperature, and other flu-like symptoms as well. It's pretty hardcore.
I wouldn't like to have herpes. A physician once wrote that herpes comes out of hibernation when the virus travels along the path of an infected nerve. There may be no noticeable symptoms when this happens. This physician reports that when this occurs, any other area of the skin served by the nerve cell becomes capable of transmitting the virus through contact with another person's skin, such as sexual intercourse.
Wow.
Now it's time for our solution to herpes. So our solution is to introduce a frequent checkup system with your GP. Also, our other solution is to distribute condoms, in Australia. And of course, some opposition that may face this is, the Catholic Church and their relentless opposition to condoms, among other things, but that's our solution. I hope you enjoyed this video, and would you like to sign off, Leo? Oh, wait.
I would actually like to sign off. My name is Joseph Feller. I have herpes, and these guys are going to help me with that.
This is Charlie Fine, I'm Leon Salveggio, and our goal is to reduce infection rate of herpes by 20% in Australia by the year 2025.